Now let us just go back to the presentation. Amit Nabil is coming. Well, so now you can see the slide, and you see that most of you, yes, we haven't discussed this number 5 about lacking time in for exercise. Yes, Joseph, what are your ideas? What should you?
Okay. He can organize his time and try hard, even if the time he will exercise is a little, and if it is 1 hour or half an hour, it will be sufficient for him. But the most important thing is that he should continue to do it daily.
Yes.
Can I add, Doctor?
Are you Nabil?
Yeah.
Please.
Yeah, I want to add that maybe he will change the way that he will go to the school, to the work, and instead of going on the car, maybe he will go walking or on the bicycle.
Exactly. Yeah. Yes. Just to change the stereotype of how to move from one place to another. Yes. Okay. Okay. Thank you, gentlemen. Great ideas. And there is one more.
Can I answer about the last one?
Yes, your name?
Sala.
Sala, please.
Okay, the last one, it will be like he is can do this while where he work by making some simple exercising like movement such as hand rotation or standing and sitting.
Even if you can't leave your workplace, you can do something with this, yeah?
Yes.
Joseph, what do you have to say about this?
If he is not able to get a vacation, he may be able to take advantage of the weekend or organize the rest of his vacations days and his work such that he spends his time to avoid and accumulate on him, and then he can find time to do what he needs.
Okay, very good advice. And so actually we were speaking about doing something, changing something gradually, about time management, about, so what else? Like about self-motivation, yes? And the question here, which ways of negotiating and encouraging the patient are the best? So which ways work better?
Can I answer?
Yes, please.
I think family. If you are saying, if you do this, your family will be happy. Or if you do this, maybe your family will be disappointed about you. I think, and more best encouraging, it's talking about family.
I see. Great. Yes, very interesting idea. And does it, will it work in all cases, or are there any people that may not follow your advice in such a situation? Who are not inspired by this idea? So I guess people are different, yes, and doctor should find so the key to everyone. That is why, so first the doctor should ask some questions, ask the patient some questions to understand his real motivations and his conditions. Yes, Joseph?
And doctor, the way to talk to the patient by advising him in a good and understandable way and giving him examples of people who were like him and treated for what they were.
Yes, providing examples. Yes, very good.
Yes, doctor. Maybe also you could look at his habits. If he, for example, like swimming, you will advise him on his desire, in his passion. Yeah.
Okay, yes. Anyways, you should learn something about the patient, get some information from the patient. Now let's, if we've just emphasized the best way of negotiating and encouraging the patients. So here is the practical case study, just to try to use these ideas in this just situation. So some facts and figures on smoking are taken from Oxford Handbook of General Practice. In the United Kingdom, 12 million adults smoke cigarettes, and a further 3 million smoke pipes and cigars. And the prevalence is the highest are aged 20 to 24. So smoking is popular in this age group. And there is the case. Discuss how to deal with this case. Okay, let us listen, just let us make somebody to read it, like Busaina, will you read this small short extract, please? Busaina. Busaina, hello? No, Busaina. Then if we ask Tala, please. Tala, hello? Yes, read it, please.
Okay. A 15 years old male patient, Mr. Harding, is just about to be discharged from hospital. He has smoked at least 20 cigarettes a day for most of his adult life. Talk to him about stopping quality. I will talk to him to the smoking, the most education society about the dangers of smoking because it affects the lung and lead to death.
So you just give him the information, yes?
Yes, and advise him.
Advice to stop smoking. Okay, this is one of the ways of encouraging people, the patients, to change their lifestyle. So we were also speaking about the other ways. So who can give some more ideas?
Yeah, maybe I will give him schedule to decrease the number of his cigarettes in the day. So he will leave it gradually. Also, I will describe to him some medicine that will increase his desire for the cigarettes, for the nicotine.
Okay, so there are some nicotine patches, yes, which can be used instead of smoking cigarettes. And one of the ideas was to that the strongest motivation is connected with the family. So how can we just involve family in this case? Yes, Yosif?
We can give him some logical and realistic advice about stopping and the benefits that will occur to him when he stops. He could have lived more in good health if he stopped smoking and occupied himself in the hobbies he wanted to do.
Yes,
Yes.
that I want to add about
Yes,
the
please.
family.
Yes, about the family.
Yeah, when we talk about the family, it's the passive smoking. which the other people in the same room will breathe this smoke. So
Mhm.
yeah, so they will have some disease because of this. So
Exactly. If the person loves the members of the family, he he will take care of his children and all people around who also breathe in smoke together with him. Yeah, and it can affect their health negatively. Right. Mhm. So there are no easy ways or just one standard way of persuading people to change their lifestyle. So it's very individual. That is why doctors should find the best ways, the best solutions for each case. And mhm. Now I would like let us just read the article about overweight and obesity. So like this is the information taken from the journal Australian Social Trends year 2007. And it says that overweight and obesity pose a major risk to long-term health by increasing the risk of chronic illnesses. Thus, in 2005, 7.4 million people aged 18 years old and over, which makes 54% of the adult population, were classified as overweight or obese. This is an increase from 5.4 million adults. That was 45% of the adult population in 1995. So like in 20 years or in 10 years, so the increase was from 5.4 million to 7.4 million people. Yes, and just 10%. Okay, and before we start reading, let us try to complete the sentences with our own ideas. So the first, what do you think? Just try to predict some information. Well, if we ask Dilara, what do you think of the first sentence? Can you complete it?
Yes, I think obesity is the result of an energy imbalance.
Energy imbalance.
Imbalance.
See. Okay, interesting. Energy. Energy which comes to the body and goes out of the body, right? Mhm. I
Right.
see. Okay. Bere, please. Number 2. Bere,
Yes,
how is
a
it?
large stays fractures a sense tissue with obesity are
So, what are the factors associated with obesity? What are they? So,
lack of exercise,
yes. So, lack of just physical activities in general. Yes.
yes,
Exactly. This is one of the factors. And what about the other factors associated with obesity? What are they? Who can tell us about this? Do people eat much than it's required, more than it's required?
yes,
And laziness.
Laziness. I see. Yeah, I see. This is a very strong factor, right? Mhm. Okay, Desginur, sentence number 3. Will you complete it, please?
Obesity affects long-term health by
Mhm.
health by diseases
Diseases.
or diseases, risk of diabetes and much cancer, doing disease and increasing.
Mhm. Mhm. Yes, of course, there are a lot of risks, yes, in this condition. Okay, and Businur, so sentence number 4, please.
Cost of obesity in Australia was, I think, it's about $1 billion. Let me open to this 5.4.
You have already just had a look at the text, yes? Yes, the cost is very high. Yeah. Now let us. Thank you. Now let us read the article just to understand how much it costs for the Australian government and just how many people are overweight and obese in Australia. And let us just ask Jiren. Start reading, please.
Overweight and obesity have become worldwide concerns, reaching epidemic proportions. Obesity is caused by an energy imbalance, where energy intake exceeds energy expended over time. This imbalance has been linked of lifestyle factors such as increased consumption of foods with high levels of sugar and saturated fats, as well as a reduction in physical activity.
Yes, so this is what you've said about imbalance, energy imbalance, and so consumption of food, sugar, fats, and the lack of physical activity. Okay, good. So Yahya, please, let us just read the following part. Yahya.
Illness costs Australian society and governments a total of 21 billion in 2025. In July 2026, as Australian government implemented a 5 years, $500 million program. The Australian Better Health initiative aimed at reducing the impacts of chronic disease, which includes a focus on promoting healthy life.
So you can see here the names of the chronic diseases associated with overweight and obesity, like diabetes, cardiovascular disease, cancer. And you can also see how much it costs to Australian government. So I mean obesity. And yes, and you can also see how the Australian government just plans to deal with obesity among the people. So just they have some kind of program which costs $500 million. Okay, the next is for Mustafa Sabir, please.
This article discusses adults who were classified as overweight or obese according to their body mass index (BMI) based on self-reported height and weight.
This is that was the chart that we've discussed about the balance between the height and the weight of people. Okay, and now the next part is for Busaina, please. She's absent. Mohamed Nabil. Mohamed Nabil, are you here? Hello.
Yes, yes, yes.
So read this part of the article, please.
Yeah. In 2004 to 5, more than half, which is 54% of all adults, or 7.4 million people aged 18 years and overweight, either overweight or obese, an increase from 45% 5.4 million adults in 1995. Using age standardized data, the rate of overweight adults has increased from 33% in 1995 to 36% in 2004 to 5, while the rate of the obesity in adults has increased from 13% to 18% over the same period. Each of the national healthy surveys conducted since 1995 has reported a higher rate of overweight and obesity for males than for females.
Mhm. It's interesting fact. We can see with there is a number of figures here, and it's like the higher rate of weight and obesity for males than for females. So, and yes, different data are compared here in this paragraph. Okay, so the next piece of information is for Tala.
Yes, teacher. It will be for many people, parasitic men and older women, self-presentation about versus acceptability weight differ from standard BMI definition. This may have implication for the management of healthy body weight in adults. In 2004-5, more than half an adult, 30% of males and 59% of female considered that themselves to be acceptable to weight, and the proportion of males 32% and females 38% who considered themselves to be overweight and considerably lower than those who are classified and overweight obese according to their BMI 62% and 45% respectively.
It's not only about how much the people weigh, but this is about self-perception, whether their weight is acceptable for them or not. Okay, and then, so Yosif, please, the next piece of information is for you.
Okay. Between 1995 and 2004 to 5, after adjusting for different differences in the age structures of the population, the proportion of people in the overweight and obese BMI categories who considered themselves to be of acceptable weight increased in 2004 to 5, almost half, 47% of males and around 1/5, 21% of females who were overweight or obese considered themselves as to be of acceptable weight. This compares with age standardized rates of around 1/3, 35% for males and 12% for females in 1995.
So people who were overweight or obese, so they considered themselves to have the normal weight. So, and the percentage of such people increased compared with like 10 years ago. Well, now we've read the information. There's a lot of data, a lot of numbers here. Now, according to the text, so can we complete the sentences? So actually, we've already had a look before we discussed this, yeah? And what does the article say about obesity as the result of what? Dilara.
Yes, doctor. Obesity is the result of energy imbalance where energy intake exceeds energy expanded over time.
Okay. So, and the second, Bere?
Lifestyle factors associated with
Associated.
obesity are it's a changing healthy body behind and waiting, but depends adult and child.
The factors associated with the obesity. Yes, consumption of foods with higher levels of sugar, yes, and saturated fats, and reduction in physical activity. Okay. Eskinur. So number 3, please.
Obesity affects long-term health by increasing the risk of chronic diabetes, cardiovascular disease, and some cancers.
Yes, the increase in the risk of chronic diseases. Okay.
Yes.
Businur.
Yes.
Number 4, please.
The cost of obesity in Australia was $1 billion. How much billion? I think maybe it was cost to 20 billion.
How many billions?
20 billions. Sorry,
20.
my voice is.
20
I'm
billion.
thinking.
So
Yeah,
text says 21 billion, yeah?
21,
Let us
yes.
Where is it? Where is it? Yes,
21 billion.
21 million. Okay, and so Jiren?
I don't know.
Is Jiren here?
Yes, I'm here.
So number 5.
I don't know.
You don't know. Let us just try to figure it out together. Higher rate of obesity. Who can help us? Yehia, what do you think of sentence 5? Who have a higher rate of obesity?
The energy.
Who?
Okay. Who eat more than.
Okay, actually, this phrase is used at the bottom of this slide. So this is about the research of 1995, which says that who has the higher rate of obesity, males or females?
Females.
Has reported a higher rate of overweight and obesity for males than females. Yeah, so males have a higher rate of obesity than females. Okay, and the last sentence, please, Mustafa Sabir.
Self-perception of one body weight among men and older women has implication for
Implication for what? Who can help us? Implication for management, yes, of healthy body weight in adults. Yes, and actually this is there is also information about some the specific government programs organized and funded by the Australian government just to decrease the level of overweight and obesity in Australia. Okay, and so the question here, can the medical profession alone change perceptions about lifestyle, weight, exercise, smoking, and drinking? Only doctors, can they solve these problems? Okay, Mohammed Nabil, can you answer? Mohammed Nabil is not here.
The first question.
Yes, the first question.
No, I think not only the doctor, also when you train, you have someone to guide you, coach or something, which give you the right way to do the exercise. Also will give you a schedule for your what you eat, what you don't eat. So that's what doctors do.
Okay, and I also think that there is a very high role of media just in helping people just changing their lives.
also
Yes,
psychology.
Psychology. Who's psychology?
What?
Whose psychology? Do you mean that people need psychological help just in to solve their problems?
Yes.
Yes, sometimes not just change something physical, but also understand something to change their mental problems, to solve their mental problems. Yes, Yosif?
Doctor, of course, doctor not alone cannot change this concepts, and society in general must be aware and encourage the fight against obesity and its like obesity.
Okay, thank you. Actually, so